Inner Voice, a heartfelt chat with Dr. Foojan.
Hello, everyone. Welcome to the Inner Voice podcast. So great to be with you today. I'm Dr. Foojan Zeine, psychotherapist and author and the originator of the awareness integration theory. Our heartfelt chat is about what matters most in our life, our minds, our thoughts, feelings, actions, relationships, and our fulfillment in this beautiful journey of life. For all of you beautiful people who are constantly asking about, hey, what's going on next? Is our Foojan app is out. It's launched. You can get the app from the Google Store or Apple Store. Just look for Foojan app, Foojan app. This app, what it does for you is it will take you through the awareness integration theory, specifically all the interventions, all the 6 phases, and it will support you to go through different areas of your life. Every month, you've got 3 different areas where you can work magic and become aware. Some of the phases will help you integrate. You'll find out what skills you don't have. You can go to the library of all the experts and gain a lot of skills and do goal setting for the future. And you can also find support with certified therapists and coaches through the awareness integration therapy. So go get Foojan app. In this episode, I'm so honored to chat with Dr. David Rabin. He's a neuroscientist, a board-certified psychiatrist, a health tech entrepreneur, and inventor who has been studying the impact of chronic stress in humans for more than a decade. He's the co-founder and the chief innovation officer at Apollo Neuroscience, which has developed the first scientifically validated wearable technology that actively improves energy, focus, and relaxation using a novel touch therapy that signals safety to the brain. Guess what? I'm wearing it right now. It woke me up this morning, and it's an amazing tool to have. Dr. Dave Rabin has always been fascinated by consciousness and our inherent ability to heal ourselves from injury and illness. As such, he has specifically focused his research on clinical translation of non-invasive therapies for patients with treatment-resistant illnesses such as post-traumatic stress disorder and substance use disorder. Dr. Rabin is also a co-founder and executive director of the Board of Medicine, which is a nonprofit organization of physicians and scientists establishing the first peer-reviewed evidence-based clinical guidelines for the production and safe use of currently unregulated alternative medicines, including plant medicine. The Board of Medicine trains and certifies healthcare providers and provides quality control standards for complementary and alternative medicine to support high-quality clinical research, best practices, and risk reduction. He is also a clinical, he has a clinical psychiatry practice and currently conducting research in epigenetic regulations of trauma response and recovery to elucidate the mechanism of psychedelic-assisted psychotherapy and neurology of belief. It is an amazing conversation. I couldn't stop conversing with him. He is so he's so rich in content and in information. So I hope you enjoy this conversation as much as I did. Subscribe to this podcast, my YouTube channel. Connect with me through all of my social media and my website, FoojanZeine.com. Don't forget, go get the app. Foojan app, or go to Foojan.com to get to know about the app. Now, without further ado, here is Dr. David Rabin. Dr. David Rabin, it is so nice to have you on the show.
It's so nice to be here with you. Thanks so much for having me.
I have had the opportunity of meeting you. Actually, this is the first time I meet you kind of in person via Zoom. We've had conversation together, and we are writing a paper together. You have an amazing background, which is fascinating to me because you are doing a lot of amazing research in different arenas, some of it in the plant medicine and psychedelics and, the effects of psychedelics on mental health. And you also have created a device that it also helps with a different mechanism within the body and mental health. So I want to explore all of it today. Where would you like to start?
Well, anywhere you like. I think it really starts with safety.
Okay.
Right? I think that's the story that we all should have been taught when we were kids about the fundamentals of how our nervous system works, which is that we have our part of our nervous system that is involved in our day-to-day functioning that we're paying attention to right now, like the part that's listening to the sound of our voices and the part that's tuning into this show, and the part that's engaged in the conversation is our conscious part that we're in control of at any moment. And then there's the parts that lie underneath, which we call the autonomic nervous system, which is broken down into, as you know, the parasympathetic nervous system, which is responsible for rest, digestion, immunity, reproduction, and everything that's empathy, everything that's important for recovery and bonding and enriching our lives. And then there's the sympathetic system, which plays an equally important role, if not more important, which is to keep us alive and to be responsible for the fight, flight, or play dead response in certain cases where we're trying to escape from some threat that would actually compromise our survival. And so if we are, the reason why this is so important to understand is because our bodies only have so many resources to go around, right? We only have so much blood flowing in our arteries and veins. And so if we are always in a threat state, the way the body gets us out of survival mode and out of threat is it directs all resources, all blood flow, as you know, to heart, lungs, skeletal muscles, the motor cortex of the brain, the fear center of the brain, the occipital cortex, the parts that are important to detect threat and get out of that situation to safety as quickly as possible. Right? Because if we don't want to be thinking about reproduction or empathy or digestion when we are potentially running from a predator or like a lion, right? That would result in a very unfortunate situation and no reproduction down the road. So we don't want to be distracted in those situations. So when we have blood flow going in those places to get us to safety, that's important. And then once we get to safety, we want the blood vessels to the skeletal muscles to constrict a little bit, which then sends blood flow back to the reproductive system and the digestive system and the immune system and the sleep and recovery systems that are important, essential for being healthy. And we need to make sure we maintain that balance. And so tools like Apollo that I'm wearing here, and tools like meditation, breathwork, mindfulness, et cetera, and also psychedelic medicines, when used properly, have ways of helping to restore that balance for us, which helps improve overall health, which is really exciting.
It's very important. What you're saying is that we're not necessarily always in a place of predatory, but because we're human beings, we also perceive a lot of what's happening from us, maybe from a predatory perspective, like we're in a job and we're, competing, or we're afraid of things, or if we're on the road. So somehow, as the minute that we wake up and listen to the news and the war and everybody's killing each other and all of that, somehow we put ourselves in a state of consistently surviving the day.
Right.
And there are different things that we are actually needing in order for us to calm us down and pick up, kind of ignite the relaxation, and then therefore going to sleep. So first, since we talked about Apollo in this conversation, how does Apollo work? Because you also, as I was reading about it, it has the sensory of touch. Does the touch itself calm us down and let us know that we're safe? And is that where the device starts kind of by touching and signaling to our skin, letting us know that, hey, the world is safe, you can calm down now?
Yeah, exactly right. And touch is really interesting because it's one of our oldest signals of safety from the early days of mammalian development, right? We're all held by our mothers and we're, coddled in a way that conveys safety when there's no other way to really convey it from mother to child. Because the infant, especially newborns, are completely and utterly defenseless, right? And they've just left their place of complete safety, and now they're in the real world and they have to breathe and do things for themselves. And so there's a lot of, trauma that happens physically to a baby as it's being born. And so that bonding experience through touch is something that is not unique to humans. It actually goes back probably tens of millions of years to the earliest mammals. And so it's in that way, it's hardwired into our system that being touched in a nice way calms us down very, very quickly. And in doing so, it boosts vagal tone, meaning it increases the activity in that recovery nervous system. And there have been a number of studies that have shown this, and you can measure it by looking at heart rate coming down and respiratory rate coming down and becoming deeper, and blood pressure coming down, and people feeling self-reports of people feeling calmer, and all of these things going together strongly suggests that there is a boost, especially when it's reliable, there's a boost in this recovery nervous system activity. And we know that touch also increases neurochemicals that are positive for recovery, like endocannabinoids, which are our natural cannabinoid molecules we make in our bodies, endogenous opioids, like and endorphin molecules that are our natural pain relieving molecules, and also serotonin and dopamine, of course, right? And all of and oxytocin, which facilitates bonding. All of these neurochemicals are able to be released when we are experiencing soothing touch. And this is, a lot of what targets our reward center and makes us feel good. So it's not that surprising that touch has this effect on us. Like any soothing experience can provide it, but touch is extremely a potent way to activate the safety response in the body. And it's also something that we don't tend to get enough of in our day-to-day lives. And it has this dramatic impact, in that it's also we're not taught about it that much. So it doesn't really, in medical school and medical training, we don't really talk about therapeutic touch in the same way that it used to be taught, way back in the history of medicine.
And I think as we grow up, we lose that concept of being able to touch, like beside mates, that at times create a touching environment, and that's mostly around sensuality and sexuality. But the concept of a bonding touch or a comforting touch gets less and less between people as they grow up from childhood to teenagehood even.
Right.
And when some societies, I think mostly in Western societies, it becomes less than maybe even the Eastern societies or Middle Eastern societies, which touches a little bit more into, they're into each other's boundaries, that becomes less. So the Apollo creates the effect of touch.
Yeah, but using gentle vibrations, which are sound waves, we figured out how to send signals to the skin that feel like touch, like soothing touch, which are gentle sound waves that you can feel that oscillate up and down at a rhythm that helps our heart and our lungs get into a state of flow or of presentness, which is effectively what we strive for when we practice meditation. And so by nudging the body, and we know that this works from music as well. The neuroscience of music shows that you can introduce a certain rhythm into the body. We know from people dancing, right? For thousands of years, people have used music to help us change our own rhythm and help us move and help us feel different. And so Apollo is effectively music composed for the skin instead of the ears that helps nudge the body slightly up or slightly down if you're trying to focus or you're trying to sleep. And the sound waves are customized to each state, and you can basically choose what state you like to be in and schedule it, and then it turns on and helps you be in a more focused state in general. So for me, I always use social and open mode, which is my public speaking mode for me when I'm giving presentations, because it just helps me be more in the moment with what I'm doing and not think about it so much.
I would assume that it really lowers anxiety too. You've done research on how much it has reduced anxiety?
Yeah, for sure. I think that's the main, and especially helps people cope with anxiety better because you're more in your body and less in your head overthinking it. But we did one study in particular. We've done a number of studies that have looked at anxiety as an outcome metric, but one study in particular looking at nursing staff working in nursing homes that I thought was really interesting, which is because that's one of the most stressful jobs that nurses have to work. And the shifts are long and they're very hard and questionably rewarding at times. And so they wore Apollo for 2 weeks, and within 2 weeks of use, without any instruction other than a pamphlet that we handed them with the guidance, they had using a clinically validated anxiety score, they were scoring 40% lower just after 2 weeks of use.
My brain is going all over the place. I'm thinking all of the mental disorders or emotional disorders that are fueled by anxiety, such as addiction, such as eating disorders, such as traumas of people who have been physically abused or sexually abused, OCD, PTSD. I mean, I'm looking at all of these things with the basis of all of these are anxiety, how much this device could support and how much research is needed in all of these areas to see how a healing touch or the device that brings the body to that space and promotes the parasympathetic to get ignited for someone who has been so traumatized that all that their body is used to is getting them in alert mode. And, there isn't enough, let's say, cognitive conversation that could calm them down. And sometimes it doesn't. It even gets them more into that.
Right.
How much such a device would actually be beneficial for them.
Yeah, that's why we made it, right? And for those who don't know, my background, I'm a psychiatrist and a neuroscientist, and I've been studying trauma and addictions for the last 10 years and chronic stress for almost 20 years, and really just seeing this huge challenge that we're facing with folks with these disorders, especially addiction and PTSD, where anxiety is a core component and the anxiety is not addressed effectively, and the trauma or whatever happened to them that's at the core of their experience has created, or maybe sometimes multiple things, has created a fear response. It's lasted a really long time, and much longer than was intended to originally. And so their body expresses that, right? They're sweating more often, they're racing thoughts, they hypervigilant, they're always like looking around, looking for threat. They have a higher resting heart rate, lower heart rate variability, and they're just generally, not present, and because they don't feel safe. And that is, given, what has happened to them, you might not expect that to be that strange, right? But when you start to work with people in that environment like we do, and we start to do the psychotherapy and start to help people understand they are safe, they're safe with us, we can hold safe space for them, and we can give them tools like Apollo that help guide that experience, where they can take that safety that they feel in the office with us home, right? Then they can continue the process, the psychotherapeutic process, the therapy work, the medicine work that we do in traditional Western practice, and they could take that home with them and have an easier time because they have something that helps them remember how to self-soothe. Because most people just don't remember breath work or meditation when they're stressed out, and most of us never learned it when we were kids. So it's so much harder to learn it when you're an adult, let alone when you're an adult with PTSD or anxiety disorder, right? It's just so much trickier.
Yeah, and to be honest with you, a lot of people who have anxiety and they've been traumatized before, that the minute they come into this meditative state, they actually get flooded with a lot of the thought and visions and things, and they can't stand it. I mean, it takes a huge amount of training for someone who is anxious or has been traumatized to actually get to sit into their own space until they pass through this and they can kind of like train their body and brain to get there. But at the beginning, it's very, very difficult. So a supportive device like this can really work in their advantage of getting them to a space where they can actually calm down physiologically before they can get into a training of their own mind into the system of, how they want, like, to say something, and then their body listens. But at the beginning, their subconscious is having too much conversation for them to even be able to handle it.
Right. Yeah, that's exactly it. And if your body's in a fear state, when our bodies are in a fear state because of any reason, we naturally oppose change, right?
Yes.
We naturally oppose newness because newness appears threatening and familiarity feels safe. And so then we pursue things, even if they're unproductive, like smoking or drinking or whatever, video games, right? Netflix binging, right? The things that aren't necessarily great for us, but we do it for relief because it's
We just
familiar.
avoid. If that's
Yeah.
a part of avoidance, it doesn't do anything, it doesn't heal anything, we'll just
Right.
avoid it for a little while.
Right. But it's familiar, so it feels safe. And so remembering that there are actually much healthier ways to remind us that we're safe, so we don't go for those vices or the things that aren't actually helping us. We can realize we have a choice. We can do, we could do some breathing or do some stretching or go for a walk or, turn on my Apollo or any other number of things that we can do. Practice gratitude, right? There's so many things that we can do that can help us to enrich ourselves, rather than taking away.
So taking this now, going into the psychedelics, what got you interested? I know I've noticed that a lot of obviously psychiatrists and neuroscientists are past, let's say 10, 20 years, have gotten more into the conversation of wanting to do research in psychedelics. So obviously in the 60s, at Harvard, we had that. And I still listen to Ram Dass after he moved on to his spiritual world, and yes, there was a huge backlash, and then now we're seeing the Western science coming back into this concept of let's do research, let's really look at, and let's not be afraid of it. Let's really see how it can support us. And obviously, there's a lot of research that's happening right now in Johns Hopkins, MAP, and Berkeley Institute. And there's a lot of different institutes that are doing a lot of amazing research. What got you interested in this field?
I think the main thing that got me interested was just practicing medicine and seeing that in mental health in particular, that a lot of our treatments were just not working well for people. And our patients were just not getting better. And when you're a physician or a clinician working with, people with mental illness in particular, and you're spending a lot of time working with them and you're tracking your own personal metrics of how well you're doing as a clinician based on your outcomes, and you're doing what the book says, but it's not actually getting the outcomes you were told that you were supposed to be getting, then, you start to look at the literature and see, naturally, as an inquisitive person, I'm like, what are other people saying, right? What are the other psychiatrists and psychologists seeing? What are they writing about? And it became very clear that there were lots of other people like me who were, practicing Western psychiatry by the book, and a lot of their patients were not getting better with the treatments, or at least not getting better long term with the treatments that we were offering, and that it was also becoming clear that psychotherapy, talk therapy, combined with medication is much, much better than just medication alone, which I think is something that a lot of people often don't understand, and even a lot of physicians still don't understand necessarily or fully have internalized. But even SSRIs work better with psychotherapy, like 20% better. So it works better. We get closer to our goal outcome when we have psychotherapy. Unfortunately, most antidepressants are just prescribed alone, right? And there's not a lot of talk therapy involved. There's not a lot of processing work. There's not a lot of stuff that we do on the psychotherapy level to actually get to the heart of what's going on. So, and that doesn't seem to work very well. So all that taken together, I started to naturally look for anything else that could work. And when I started to investigate other disciplines, other Western techniques, psychoanalysis, and other psychotherapy techniques like psychedelic psychotherapy, it became very clear that there was a lot out there that was very promising. And in 2012, one of my good friends and colleagues in the medical center sent me a folder of papers that had a whole bunch of psychedelic research in there that was that were really incredible studies published by wonderful, really talented investigators from world-class institutions with great journals. And I was reading these papers and I'm like, this is the real deal. This is people actually studying new therapies for hard to treat mental illnesses. And I'd always wanted to study consciousness as a kid and thinking and meaning. And this was my opportunity to do it because that's what was happening with these people as they were having these experiences. And so it was just all at once in 2012, I kind of made my decision that this was the field that I just had to pursue.
So one of the experiences that I hear that it's a lot there, and as an experience, is this delusion of separation, which we hear a lot in the spiritual world, but this delusion of separation, and then coming back into a space of oneness. So there's something beyond just the regular thought process, that you get into a thought process plus a lot of amazing imagery and symbolism. And it's almost like everything that is already there, it shows up and it connects itself. So, and many of the research has shown that it actually, when they've done the functional MRIs, as they're utilizing like psilocybin or LSD, I don't know if I've ever heard that they've done that with ayahuasca, but they actually see that the connections into the different areas of the brains are getting created. So is it more about how these connections support each other in the area of recovery or healing some of the, let's say, mental disorders, such as like depression or addiction or anxiety, and some of these which have really done the research on? Is that where you see the mechanism of this working?
That's a really good question. I think that it's a big answer, but it starts with Eric Kandel's work on memory and who Eric Kandel won the Nobel Prize in 2004, discovering the mechanisms of learning and memory for not just humans, but also going all the way back to ancient animals like these 300 million year old sea snails that only have 12,000 neurons, whereas we have billions of neurons, and our memories are formed in a very similar way, which is really, really interesting. And so he was able to figure out in large part how we form memories. And then that information can kind of be distilled down into a practice makes perfect model of thinking around memory, which means that the more we do anything, the better we get at it. And the reason why we get better at it is because as we practice anything, doing something like washing dishes, or doing something like learning how to play piano, or thinking about ourselves in a certain way, like I am a nice person versus I am a bad person and I don't deserve love, things like that. Those kinds of actions, every action, but actions like that all create neural networks in our brain between those thoughts and our identity and sense of self. And so every time we think about me as being somebody who's good at piano, but also a crappy person and not worthy of love, the better I get at thinking about myself in those ways, and including internalizing those concepts of what psychoanalysis calls like almost object relations, or object identity. And it's like this object identity relationship where we start to be relating ourselves to somebody who's not worthy of love, so that every time we think about ourselves, we think about, oh, well, that's Dave, he's not worthy of love, right? And it just gets ingrained in our neural network so deeply that we can forget where it comes from. Even it just becomes part of us. And the reason why that happens is because our brains are these brilliant, miraculous automation machines. They are extremely capable of learning and automating pretty much anything, but we were taught to automate those thoughts or those things and do those things, and those things might not serve us. So we have to update the automation machine. We have to remember that it needs to be revised and upgraded. And so what ends up happening in the state where we've trained ourselves to think about ourselves in a not good way. Like, for example, rather than saying I feel depressed, which means I feel depressed right now, we start saying something like, and you'll notice the way I use words is very important, because words have meaning, and then that meaning gets ingrained into our brains through hearing it and in internalizing it. So if I say I feel depressed, it means I feel depressed right now. If you say I am depressed, then what we're saying is I am a depressed person. Subconsciously, that's what we're saying, whether we realize it or not. And when we say I am depressed, and those are the words we choose to use, that can mean I am depressed, meaning my identity is depressed before, during, and after this moment, right? Which means that it potentially applies across time. And the more we think about ourselves that way, the more we start to think, well, I am a depressed person, so this is just the way I am. And we see this thinking a lot in our depressed patients. It's a very, very common way of thinking. That way of thinking gets parceled together into our brains in a network called the default mode network, which is the network that relates our sense of self, self-identity, to decision-making for the most part, ego, preservation, self-preservation, and all the concepts and thoughts and ideas of the way we were taught to think about ourselves in the world that connect to each other and talk to each other on a regular basis. It's not exactly the same in all of us, but it's pretty close to the same in most people, because we were all taught to think about ourselves in the world in a very similar way, which is really interesting. And so these parts of the brain are what's active at rest when we're just kind of sitting there. And we call that the default mode network, which is what pops up on neuroimaging. And it involves a whole bunch of parts of the brain. All of a sudden, you introduce a psychedelic medicine or a psychedelic drug, and then all these parts of the brain that normally talk to each other, and also you could do this with a meditate. People do this in meditation states as well. We've seen these parts of the brain change. The network that we call the default mode network, which is effectively the default way we were taught to see ourselves in the world, starts to dissolve, meaning that the parts of that network that were talking to each other are now talking to each other in different ways, not necessarily less, but different. And they're talking to different parts of the brain that weren't normally part of that conversation. So meaning that's where the idea of synesthesia comes from psychedelic experiences, which means being able to see smells, right? Or being able to smell colors. You wouldn't normally think about that because we wouldn't normally experience that in our day-to-day. But when you have different parts of the brain talking to each other, or parts of the brain talking to each other in ways they wouldn't normally talk to each other, and the default mode network around self and ego is not as dominant, or it's off entirely, all of a sudden you start to have like cross wiring happen, which isn't necessarily bad. It actually may promote neuroplasticity, or the building of new neural networks in the brain, which is why people can have these experiences and learn so much from them, and then actually come out with 12 weeks later, after having a few psychedelic experiences with a trained therapist, they can have a new take on life and no more PTSD and really great outcomes, because we're literally working with them to help the patient rewire, in a lot of ways, the way that their hardware, their brain is working, to change their thinking. And the medicine is like the molecular assistant that helps us get there.
And as I assume, and I've heard from people, and my own experience, is that there's also a change in, it's almost like there's a change in the chemical aspect. And somebody who has been depressed for such a long time, suddenly they don't necessarily experience the same sort of depression or anxiety. So something very deeply changes into the system versus just a shift in a thought process, let's say.
Right. I mean, it depends. There are certain experiences that people, I mean, if you're talking about the therapeutic experience with a psychedelic medicine delivered in the proper way that we deliver, or with, in the MAPS model, in general, you're going to have those kinds of outcomes, yes, where there's actually very distinct, very clinically and statistically significant changes that are likely going to be reflected in neuroimaging. Although I don't think we've seen those studies yet, but we would be very likely to see changes in that way. I think that there are other situations where people might have less of an experience or have a negative experience. It could go the other way when it's in an uncontrolled environment. So it really just depends on, what the person's open to, the participant, and the environment around them as well.
So, for example, a couple of experiences where I was working with a client who had been on opioids for almost 10 years, a high dosage, and every time she went on Suboxone and came out and was cleaned up from the physical aspect, she experienced this tremendous amount of and depression, and she couldn't move. So a lot of times this was the cause of her coming back into opioids so that she could, and actually it was interesting because the opioids were behaving as a stimulant for her after a while, because if she didn't have it, she would be really going down. And with, I think 3 sessions of ketamine, she no longer had that depression at all. And although like she was sober for 1 year, that was helpful because of the ketamine. And then even when she relapsed for a short period of time and then went back into recovery, that depth of depression that I had witnessed with her for so many years never showed up again.
That's amazing.
And that was after 3 sessions of ketamine and, with therapeutic that she had. I've also spoken with people who've had experiences with ayahuasca in Colombia and different locations, was kind of similar concepts with after having like 2 dosage or 3 dosage of the ayahuasca, that the way that their default position was always going into the deep well of, if the world doesn't work, I want to die, and they go into that deep essence. Those conversations, thought processes, emotion never showed up again for them. So a lot of shift had happened into just with even small dosage. Again, yes, you're absolutely right. We're talking about a therapeutic modality. We're not just talking about, somebody on a party having whatever dose they want. And, obviously the set and the setting are very important. Intentionality is important. Who's there is important. Integration is important. But there's also me not doing research, just with my clients, I've seen this, which was amazing results.
Yeah, you're absolutely right. It's pretty tremendous. And I think there is something that's happening that, whether it's with ketamine or MDMA or psilocybin, that people have an experience of deep self-reflection and self-connection and safety. I think the safety is critical because the psychedelic molecule amplifies whatever comes in. And that's why they're often referred to as non-specific amplifiers of awareness. So you can make yourself more aware of negative stuff or positive stuff or neutral stuff. It's not really, directed necessarily in any one place. But every medicine has its own nuances, of course, but ultimately being able to use ketamine and MDMA in that way is changing the brain. And the way it seems to be doing that is by empowering the patient through the therapy practices to remember that the source of healing comes from within us, right? It doesn't come from anything outside of us. And this is like one of the inherent struggles with addiction, is that we spend our whole lives trying to bring ourselves to a state that we don't necessarily believe we can get to on our own, or we haven't trained ourselves to get to on our own. But those states are states we always have access to. We're born having access to them. They just need a little practice to get to. And so these tools are ways that we can help people remember that experience. Like Apollo, it helps you remember what it feels like to feel safe in a stressful situation. Then all of a sudden you can realize that you have a lot of choices here, and you don't have to make the same decision you made all this time that might not have been the best one.
So part of it is romanticizing the new process. Another part is also, as clinicians and scientists, we want to be a little bit realistic about people if they're not using it in an appropriate setting, or that what are some of the cautions that people need to actually look at. I've also, although the other side of it has been that I've worked with people where they have utilized this and they've gone beyond the certain threshold, and they've become kind of desensitized or depersonalized. And then, so then they're very afraid of somehow, I feel like I'm not part of who I am. I'm not in my body. I don't experience myself. And it feels like I'm hovering from above, and I don't know how to come back and connect with my body. Or obviously with THC, or some of even LSD and the psilocybin, people who've made of predisposition of a genetic with schizophrenia, or with some of these hallucinatory might have activated some of those genes, or they've had bad trips, or they've had an experience where they scared themselves more than they actually healed themselves. What are your some of the precautions, let's say, that you could share with our audience about what to do if any of those happens, and then how to take care of themselves?
Yeah, have a really good psychiatrist. No, I mean, that's just in jest, but that does help. Having a really good therapist, on the other hand, is a strong recommendation. I believe that, the work that people do when we access the subconscious of our minds is deep work, and has to be respected. And so having a therapist or someone in your life that you can talk to, who will listen to you non-judgmentally, who you don't have to worry about saying stuff because it's not going to get back to anybody else. Having somebody like that to talk to about these experiences is absolutely critical. It doesn't matter if there are drugs involved or not, or medicines involved, or in accessing these experiences. What matters is that you're having a psychedelic experience, and which could be like a dream. It could even be a really intense dream. Like, that's why there's so many stereotypes of people going to their psychiatrists and psychotherapists and doing dream therapy, because those are some of the most common psychedelic states that we access every day as regular people. So I think that is a must. For everyone, highly couldn't recommend that more. Having a so I think some of the cautions, the direct cautions, are if you have a psychotic disorder, delusional disorder, schizophrenia, or any kind of bipolar disorder, you really want to stay away from psychedelic medicine. They're not for everyone. You want to be, if you were ever to try a medicine like that, to be extra careful and not take risks during the experience. It's good to actually be in the care of a highly trained psychiatrist who knows what they're doing, who can advise you as to how to do it, if to do it at all, and to make sure that you're in good hands in case something should happen. And then, some of most of the other contraindications are for things like ketamine are very mild. You shouldn't have like a cardiovascular disorder or really high blood pressure and things like that. But in general, there aren't a lot of contraindications to ketamine. There are more for MDMA and psilocybin, but they're not available yet. With MDMA and psilocybin, for instance, you want to taper off of all SSRI medication. You don't want to take any serotonergic medication, because psilocybin and MDMA increase serotonin a lot, and they increase the functioning of the receptor, and that can cause serotonin syndrome occasionally in people who've taken too much, which can be fatal. So we really don't want that to happen. So definitely make sure to taper off of SSRIs in situations where MDMA and psilocybin will be ingested. In general, those are the main ones. And then I think other things that you can do to have a good experience are, practicing setting intention. Setting intention around self-gratitude is always a great first place to start. Anything you can do in your space to make it kind of like a nest feel, where it's really safe and comfortable. You're not worried about anything you're going to say or do. You have somebody in the house who is not going to be intoxicated to take care of you if you were doing it on your own, to avoid any issues. It's always good to have somebody there. In the clinic, obviously there are all these people there anyway. So and there's only ketamine involved. But I think for people seeking ketamine therapy, would highly recommend ketamine assisted therapy, because ketamine assisted therapy makes sure that everybody gets the talk therapy component of it. And it seems like that has better outcomes than ketamine alone, by nature, if not for the fact that all medicines seem to work, psychedelic or mental health medicines seem to work better with therapy. And And then the last thing I'll throw out there is a plug for Apollo, which got the first patent for any wearable to reduce unpleasant experiences associated with psychedelic medicine experiences or any medicine assisted therapy, including cannabis. So it can be a tool that you can use to take with you when you're when people are having these experiences. And we have a number of ketamine clinics that are actually using Apollo in the clinic now to give to their patients in the waiting room and then to take home afterwards if they like, because it helps make the process a little safer, smoother, easier.
Dr. Rabin, what are your thoughts or suggestions about people who are not doing this necessarily in the Western world therapeutic places, but they are going into cultural and ritualistic spaces, and these are plants that are not necessarily have been part of the research lately, such as iboga or ayahuasca and different types of ayahuasca that are all out there, and many other type of plant medicine which are being part of ritualistic and healing perspective in Amazon or different locations in South America, Africa, and different places, which also have suggested that could support kind of shifting and changing even the brain mechanism of people who have had struggle with addiction for a long time. Do you know any research or any comments, anything that you would like to say about that?
Sure. I mean, I think in Western medicine, we often forget that almost all of our medicines originally came from plants, right? If you look back, aspirin, curare, vitamin C from cedar bark, right? Or from vitamin C to help with scurvy back in the day, right? And almost all the supplements and all the things that we use as medicines, not in their newest forms, but originally came from plants, and many of them from the Amazon jungle, which is where many psychedelic indigenous plants come from. And especially with respect to psychedelic and psychoactive plants that have a spiritual background and use history, these plants have often been used by indigenous cultures for thousands of years before we ever had a practice of Western medicine. And so I think it's essential for us to respect where these medicines came from and to work with indigenous cultures as much as possible to embrace their knowledge base, because we don't have all the answers. We have some of the answers. We can take care of you if you have a horrible accident, and we can treat a horrible infection that could take your life, and we could save limbs, and we can, do all this miraculous stuff that's life-saving when we hurt ourselves or get into accidents, but or when we get really bad infections, et cetera. But we are really, really not well equipped to treat chronic illness, particularly chronic inflammatory and mental illnesses. And all of our drugs have side effects, and they require one or multiple times daily dosing, and they have so-so response rates. So, I think it's imperative for us at this particular juncture in the world, and in 2023, to really, draw upon the knowledge and value the knowledge of indigenous cultures and what they bring to the table around this ceremonial and traditional use of these medicines, and to really look at that in a thoughtful way. And just because there's thousands of years of anecdotal evidence is not a randomized controlled trial, but it is really interesting, and it does shed light on ways we can do things differently and better in our own treatment programs. And studying it has even made my own influence my own practice in positive ways. It's helped my patients. So I think there's a lot of opportunity there. I think we also need to be careful, because not everyone who's advertising that they are a shaman is actually a lineage trained shaman who has gone through the cultural traditions. There's no regulations around this stuff. So pretty much anyone could go down and call themselves a shaman, even in the US, and provide these treatments and these plant medicines. And so it's really important to do your diligence, whoever you are going down there, and make sure you actually know that the people you're working with are legitimate, real practitioners who have that ancient knowledge and won't put you at risk, because there's a lot of other people around there who, in all over the world, who don't have that, and those people are around. So, really do the research and make sure that you're not just rushing this to try to find somebody to give you drugs in the jungle, but somebody who's actually going to take you through the traditional experience where, which really brings in the richness and the culture of where all this medicine originally comes from and how it was used.
Absolutely. Last thoughts? We're coming to the end of our conversation. Anything we haven't shared that you really want people to know?
I think there's a really unique opportunity right now as I was mentioning just a few minutes ago, in the field of medicine to ask ourselves some hard questions going into this next generation, this next decade, about what are we doing right, and what could we use some improvement on, non-judgmentally speaking. There are a lot of things that as a field we could be doing better. And a lot of it is not just up to us as doctors, right? There's a relationship with insurance and business and the business interests, right? And all of the things that make capitalism in the US work. At the same time, the science says that there are lots of things that we can do as practitioners that are better, but there haven't been easy ways to transfer that information from the lab to the bedside for a long time. And now with our current technology, we can translate stuff really quick, right? We can take discoveries out of the lab. Apollo is a perfect example of that. And within 3 years, we could take something out of the lab and bring it into a product that's commercially viable and available for everybody to use around the world, right? And that's pretty crazy, but it's also exciting because that's 3 years compared to 17 years precedent for technology to get out of the lab and into the real world. So there's a real opportunity here for us as clinicians to speed up that process by working together and by being more open to, working, of course, critically, but working in multidisciplinary teams, with business people, with finance people, with marketing people, with engineers, with academic institutions, private companies, and really try to figure out not just how am I going to solve this problem as a doctor? Oh, this problem's too big for me to solve, but maybe how can I solve this problem with my community, right? How could I bring people together who maybe think like me and maybe some who don't? And let's try to figure out how we can wrap our arms around, what to do to help make a dent in the opioid crisis, or help make a dent in the benzodiazepine crisis, or in the cardiovascular world, right? With cardiovascular disease and cancer, and what can we do on our level that could change, and that's not actually forcing ourselves to just do more work, and it actually enriches our lives because we get more of this. We get more like SVMT gatherings, right? Like events where we can really come together and share all the fun stuff that's going on in here and actually apply it. And I feel like we get siloed, so often in just patient care, and patient care is critically important, but we're also researchers, and we're also teachers, and we're also writers, right? And we also are advocates, and we know how to get information out there. We know how to help people heal in our office and en masse. So the more we can do that, the better.
Well, I feel blessed, and I'm always grateful to the Society of Brain Mapping that brought us together, and I've get to meet a lot of amazing scientists. Thank you so much for taking the time to be on my show. Where can people find you?
Oh, it's absolutely my pleasure. It was so nice to be here with you. And also grateful to the Society for Brain Mapping and Therapeutics for bringing us together today, or bringing us together in general, and then allowing us to do this today. Anybody can find me on socials. I always love to hear from you at Dr. David Rabin on Instagram and Twitter. You can find me also on my website at drdave.io. And you can find Apollo Neuro at apolloneuroscience.com, also at wearablehugs.com.
Beautiful. Thank you so much again for the time you allowed with us. I always enjoy conversing with you, and I learn from you all the time. Thank you.
Likewise. Thank you for having me.
And for all of you who are out there, create an amazing world for yourself and everyone around you. And until next week, bye-bye.